Welcome to today's program. We're glad you're here. If you have a question on any of the topics you hear today, please use the chat feature on your screen and a member of our staff will respond within 24 hours. We also have 2 handouts available for today's session. Simply download them from the handout section on your screen. The first handout will help you follow along with the topics discussed and make it easy for you to take notes. We've also included a document that we've shared in a previous session. It's designed to help you ask the right questions when choosing your benefit partners. For those HR professionals in our audience today seeking continuing education credit from SHRM or HRCI, please email events@the-alliance.org to request credit after this webcast. Finally, we wanted to mention that today's program is sponsored by Delta Dental and National Cooperative RX. We truly appreciate their continued support as it enables us to continue bringing valuable programs like this to you, our employers. Thanks again for being with us today. Let's get started.
Welcome back, everyone. Melina here, you know me. We're going to finish our program with a robust discussion from 3 extraordinary colleagues, employers, some with the Alliance, some before, in the past with the Alliance. And we want to start hearing our healthcare stories. It was an incredible presentation from Sam. I think it resonated with all of us, many of us. I do want to introduce the panel. So I'm going to start with John Stevens, who is the Chief Strategy Officer for WPS Health Solutions. He has 20 years of experience as a healthcare strategist and operator. He's consulted for many years with health plans and others before joining WPS in 2013. Since then, he's learned a lot because he added many hats in his responsibilities: HR, benefits, communications, and more recently, taking direct responsibility for WPS Health Insurance Division. Some of his folks are here in the room as well, including their growing ASO and Medicare supplement plans. John studied economics at Northwestern. He earned an MBA from the University of Chicago Booth School of Business. He's a board member of the Alliance, serves on the local chapter of JDRF, which is a very important type 1 diabetes research organization. And I understand that he's a coach for the JDRF Ride program, allowing him to raise money for this important cause. He also has fun with a new car that he can bring down the top. I've seen it. It's gorgeous. And fun riding the hills around Dane County. Jennifer Pegels. Jennifer is the Vice President of Human Resources for April Air. She develops there and implements total rewards programs to support employee engagement initiatives and create an environment where employees can thrive. So I also think that this the keynote speaker really resonated. So Jennifer is going to share stories with us, as are all. She has experience implementing comprehensive benefits and wellness programs that help drive employee accountability, improve health, and reduce costs. Jennifer holds a bachelor's degree in psychology from UW-Eau Claire and a master's in business from UW-Madison. In addition to her work experience, Jennifer is a former member of the board of the Alliance, and she served with us for you for 7 years, over 7 years, I think. And Michelle Golden. Michelle Golden has been the Executive Director of Human Resources and public relations for the Chippewa Falls Area Unified School District for the past 10 years. She and her HR team opened an on-site direct primary care clinic using Reform Medicine out of Eau Claire, are very good friends with Dr. David Usher. And you opened that up in July of 2017, I understand. And since then, and this is a staggering number, since then, the district has saved over $18 million in health insurance costs. Michelle, when we were talking, she said this is the only place that is a flexible budget area for us. This is the only place where we need to save money because otherwise, we're in trouble. Her experience in learning to understand healthcare and how to best save the only flexible dollars inside of an educational budget has allowed her to put that extra savings into staff compensation. And I know she also has some amazing stories for us. I am going to start with questions. Please feel free. Our folks, who is it? Rachel on the one corner and Paul Stencil on the other. They have mics. We have a lot of questions that we got from our audience before, but please step up, and help us with this conversation. Jennifer, may I start with you?
Absolutely.
What does being accountable to your employees mean to you?
What is being accountable to our employees? It was great hearing Sam speak first about his book and talking about accountability. There's so much of what he said, I think, that resonates with myself as a leader and kind of really how we've positioned ourselves as the organization I'm with today and my experience in prior organizations. And I think accountability, kind of echoing a bit on what Sam said, was really about caring for the employees' overall well-being and thinking about them as the whole person, not just what they're bringing to work, but what that means in terms of who they are as people and as, their families, and, really caring for them beyond just you come in and do work for us. And, he was telling a few stories, and it reminded me of a story that was really a tipping point for our organization in driving accountability around well-being. So we had an employee, this was a number of years ago, but we had an employee at an organization I worked for that was a long-term employee of the company, very well known across the organization. He was loved by everybody. I mean, he lived our values. He was great to work with, energetic. I mean, he was just really part of the company. And he unfortunately died unexpectedly. It was a sudden health issue and passed away. So, of course, this was, impacted the organization, but he left behind, 2 daughters and a wife and a family that now, was living without him. And I remember as part of my role, I helped to process life insurance, and the death certificate crossed my desk. And in it, the condition, there was a couple of factors, but it specifically had written in there something around, died as a result of obesity. And I'm reading this thinking, wow, this is crazy that, we've lost this incredible person. And, we have on-site workout facilities and we offer these great programs, but, have we really done enough as a leadership team to, showcase and really help employees be accountable for their overall health and well-being? So I remember talking to our leadership team about what more can we do? This is less around, the stick of, you got to work out or you got to, take care of yourself, and more about we care for our people because we want them to be, our mantra became happy, healthy, and alive. And, that fundamentally changed the way in which we approached communication, how we tell our story, how we drive accountability for employees and the leaders, and really living that from a leadership perspective through what we did. So for me, that was it was a tipping point. But again, it was, as leaders being accountable to taking care of our employees and their overall well-being.
And I have been, so do you mind if I say which company?
Oh, yeah, absolutely.
It was with Trek Bicycles.
Absolutely.
Yep. And I have been many times to that company. They are a member of the Alliance.
Yep.
And I see the living of the culture
Yeah.
of health and well-being everywhere.
Absolutely.
Yeah.
Yeah. From the top down.
From the top down. Yes, I haven't met, but I run into your CEO who had just come in from his bike ride.
Probably a
and it
bike
was
ride.
just-
Yeah.
yeah. Michelle, any thoughts on that?
I totally agree. Really keeping our employees happy and healthy is very important because we're like everyone. We're in the people business, and we feel like a big family. And when someone is suffering, everyone suffers around them. So what can we do to help people really focus on their health and wellness, and at the same time, coming to work every day and being happy.
That is awesome. John, a different question for you. Did you design your benefit plan to encourage your employees to use high value providers? And well, I sort of know the answer to that, right? So I'm cheating a little bit. How does that reflect your organizational values?
Yeah. Well, I guess you answered it. Yes, we
Yes.
do. Maybe a little different perspective because we're both an administrator and an insurer of health plans, and also we have a big group of employees, right? 2,500 employees, and more than half of those in Madison. Our organization's purpose is to make healthcare easier for the people we serve, right? So a big part of that, it can't be easy if nobody can access it and nobody can afford it. So high value care is really part of our that purpose. Sam talked about purpose a lot, and I like that we can connect our organization's purpose um, to high value care and what we're doing for both our customers and our employees. So since we have both of those, it's we get to take advantage of that in a way that we can experiment. So it's a big theme for us. We can try things high value care related with our employees, apply those lessons learned to our administrator business and vice versa. So we get great benefit from partnering with the Alliance, partnering with Oxient, partnering with others. Um, we probably tested a dozen or more ideas in the last 5 or 6 years related to high value care. Many of those have worked. Plenty of them haven't. So, but we always get some lessons from that, which is a benefit, and benefit both to us as an employer. Specific to the question, so we were one of the early adopters of the Premier Network. I'm a big believer in it. The benefit design is probably in such a complex market and a complex system for our employees and for their families. Benefit design is one of the simplest and most straightforward ways to drive high value care. So it's a big component for us. Adding to that, we've talked a lot about navigation and how do you get people to use that system. So you can have the great benefit design, but if people can't work their way through it or not aware of it, so communication and navigation are really key to us too.
That is awesome. More to come on that, I know. So, Jennifer, as a leader, is being a good healthcare consumer part of your company's culture, whether previous companies or current company?
Yeah. I mean, I think it should be part of every culture. High value care and, really is fundamental in taking care of your employees. For us, it really starts, as I mentioned, at the leadership level, and what we're doing to really mirror the behaviors and kind of expectations for our employees. We build when we think about overall well-being and caring for our teams and the purpose. You've talked a little bit about purpose. Our at April Air, we make humidifiers, dehumidifiers. I mean, we control things that control the air in people's homes. So we've really aligned a healthy air for all purpose. And then we use that to kind of build in systems, tools, and support to care for the overall well-being of our employees. And we know that high value care is a big part of that. So where we can design our programs to make access easier, to be transparent with things that are incorporated into our plan designs so that employees are getting the care that they need at the time that they need it. An example of that, especially on the benefit design is, we know with the pandemic that a big topic of conversation was the overall mental health for employees and how people were handling that and dealing with that. And so how we built that into our programs was understanding what are the barriers to getting care? How do we remove those barriers, like access to telephonic support, maybe removing the copays so that it's, that the cost burden isn't an issue for getting care. And I think by considering and listening to what are those core things that our employees need, and then from the top, really reiterating that through our culture and our values and why it matters, and kind of continuously pointing back to those things and how we behave.
That is awesome. Michelle, further on this question, how are you setting an example for your employees to make good healthcare decisions? I love the fact that you said, you're in the business of families, right? Mm-hmm. You're in the business of kids. Mm-hmm. So I love that. How are you setting examples?
So our examples, one of our part of our strategic plan is the Our People pillar. So there are 5 pillars, and I'm the Our People pillar coach. And what we developed through our strategic plan, specifically around our people, is that our people, we want our people to be their best. And so we made some commitments around self-care. We made some commitments around culture, positive climate and culture, and then also providing them the training and development they need for their positions, professional development. And so each of our buildings take the pillars and cascade those actions down, ensuring that people are using self-care. So we bring in different organizations such as an acupuncturist, or we bring in someone who's doing yoga after school. We bring in other providers such as chiropractic care, and say, yes, you can do this on site, ensuring that people have time that at lunch or on their breaks that they can get outside and get some fresh air. And we ask our leaders to also model this, say that it's okay to get out and do those things.
That is awesome. John, thoughts on that?
I think about my own experience. If I can't be a good consumer of care, nobody in my company can, right? So I make it a point to really understand our benefits. Everybody that's in this room should be in a great position, right? You should know the tools in front of you. You should probably have a pretty good sense of medical literacy. We've been in this business for a long time. A specific example for me, and I don't mind sharing. So if I have an experience, a good one, a bad one, or others, I'll share with my team. So I'll talk about quality path. When I turned 50 not that long ago, mm-hmm. There's a procedure that a lot of guys have to get when they turn 50. So I went through that process, the quality path process, for a colonoscopy. Not afraid to share it. And I kind of knew it was win-win for me and my company because of our benefit design, but also, I knew about I educated myself on the process, went through it, highly recommend it to everybody else. I'm out there highly recommending colonoscopies. I'm not shy about it, and we have other high value care providers across our network and that we use I wish I didn't have to engage with the healthcare system. We talk about that a lot, right? Mm-hmm. It's like I don't want to think about my team members as employees or patients or members, but there are times, right, that we all have to engage with the system, or most people do. So I'm thinking about this. One of my colleagues is here. I won't name her, but was struggling with getting into a comfortable place to bring a child that was at risk for some care that she needed before a trip. And I said, well, have you tried Pivotal? We've been using them for a year now. They'll come to your house. They'll do X, Y, and Z. Right. It's like, wow, I didn't know that. Like, that's amazing. So pitch to Pivotal, but we have those things. And so it's important for the leaders in our company to understand what they are and help promote those.
And you went to our friends at Upland Hills?
I did, yeah.
And I know there is others here, and I want testimonials.
Yeah.
Mm-hmm. So, not ashamed to talk about
my care team sent me a thank you card. That was a little weird.
Yes. Yes, I think you left for lunch afterwards, and they're amazing. Yes, I'm hearing.
And just one thing to jump in there.
Please.
When I think back to, some of the journey that I've had with Trek and even with April Air, you can start small. It doesn't, you don't have to have these big swings where it's, bringing on-site clinics, I think, are definitely an opportunity for many of us, but it doesn't have to be on-site clinics. It can be, small things that make, convenience of care and getting people the care that they need at a lower cost that really are going to drive, I think, that the behaviors that from a broad perspective have the biggest impact on overall well-being, but also the cost, element, which of course many of us are here, because we're trying to control that as well. So can be little things too.
Absolutely. Absolutely. Michelle, education doesn't happen overnight. Again, you're in this business, so you know that. But when it happens, it truly is a win-win for the long-term economic and success of the organization. How do you work to educate employees on the benefits of making smart healthcare decisions? And I understand that you're one of the early adopters in the Eau Claire market of the on-site, near-site clinic through Reform Medicine. So how did you help employees get educated that this is, access is better, quality is better, the visceral relationship with your provider is going to be better? How do you do that?
It's a great question. We spent quite a bit of time talking about, should we use the carrot or the stick? And we decided that we would go with the carrot. And what we did is we went on these insurance roadshows, and that's what we called them. So we basically went into every single, all of our 12 buildings and educated our staff and said, this is where we're spending our money. And how can we, and we're on a high deductible plan. And so we said, how can we help you save your money in your health savings account so that you don't spend it all and that you have extra money there? And so we shared a lot of data points about where we're spending our money and saying, we are spending $4 million here. We can cut that in half within a year's span and spend $2 million if we utilize this savings. And so we also, part of it, and it's probably another upcoming question, is we talk about our health fund checking account and then our Fund 10, which is how we pay people, and say, we can put that $2 million back into our Fund 10 so that next year when we start looking at compensation again, that money can get put in here. And so we've really used a lot of data points around when people go for preventive care, this is how much money we spend on preventive care. If we start utilizing our clinic, then we can drop that by a quarter of that amount of money. And so every year we go back to our buildings and start presenting, we present out all of the data on how much money we've saved. And so every year we've watched our savings go up and our spending go down, which has been really fascinating. And we really just have to go back to the people and say, thank you. They've done it. They have made the choice to help save money. So
that's amazing. Jennifer, thoughts from you?
Yeah. I mean, similar kind of story in terms of, the ways in which you communicate things and really what's in it for the employee. I remember when we were starting a journey of what we called, being, the plan was to have people know their numbers. So what we mean by that is know your health numbers. And it just really started with educating employees. But in order to know your numbers, you had to go through the biometric process. And I remember sitting next to an employee who hadn't been through this before, and he didn't know who I was, and we were kind of talking about it. And I said, "Hey, is this your first time, getting your biometrics done?" And he said, "Yeah, the company's making us do it, And I was like, "Oh, tell me a little bit more about this," So it was an interesting conversation, but it was in that moment that I realized we really had to flip the message here. This wasn't about the organization making you know your numbers. It was about, what does that mean to you to know your numbers? It means you can take care of, risk factors that might, lead to longer term issues. Overall, when we have a healthier employee base and people are taking care of themselves, ultimately, we believe that will also reduce our costs in the long term. And really laying that out. So the gentleman and I were talking, and I said, how do you like 10% increases in your healthcare every year? Well, of course, none of us wants to, take the 10% increase, but, educating him that he has the ability to influence that. It's not just the organization making decisions that influence those costs. It's also every one of our employees and their family members and decisions that they make and where they get care, and just overall their overall well-being, and that I think was again kind of a change in then how we approached communications with team members.
Did you ever tell him you're the VP?
Oh yeah, of course.
Eventually?
I said,
Okay.
I'm the one that's making people do that.
Talking about taking accountability, right? Yes. Yes, I love it. John, we know steering employees to high value care can be confusing.
Mm-hmm.
You and I have talked about this many times. We don't always talk about pricing. It's difficult to talk about pricing.
Sure.
Ryan Peterson is in the room, and I'll say it again, Ryan. I found out from him that an ear arthroscopy has 21 CPT codes, and the price of the 21 CPT are wildly different, right? So it's difficult to talk about pricing.
Yeah.
How do we communicate? How do you communicate to your employees about that?
Yeah. So still something we're working on, right? And I think about I kind of go back to what's the simplest way through benefit design is a big component of it. So I don't think we're there yet, but I think communicating that if you go down this path, this is a high value. You can communicate. You can potentially communicate price through how you price things in your plan. So what I mean by that is, you go to this tier 0, it's going to cost you nothing.
Zero.
In fact, we might give you money for choosing that. If you go to tier 1, it's going to be very low cost. If you go over here, that means that you're making a choice. And over here is going to be higher cost for the company. I like Michelle's idea. We haven't done this, but of having that cost benefit conversation with people, not one-on-one necessarily, but here's the opportunity, right, for us as a company. And even, I forget this sometimes, but most people don't know the connection. Most employees don't know the connection between the actual healthcare spending of the employee base and what their premiums are going to be that year, the next year, the year after that. And so I think that's a really important component of it that I think we all need to get better at.
Michelle, thoughts on that?
I totally agree. Early on, because we were losing so much money in healthcare, we ended up doubling the deductible. And that was a very painful process to go through if you've had to go through that before. But when we did that, that was when we were simultaneously saying, but here's how you can save your money. And then you don't have to meet that deductible. So we had probably went from, once we doubled it, we probably had 80% of our staff meeting their deductible completely. And now we're down to like 30% of our employees meet their deductible because we provide them information on how to choose their high quality, low cost care with that, through educating them on their choices.
And so Reform Medicine is your DPC. They're also helping with this quite a bit, right?
Yep.
They do some of the education as well?
Mm-hmm. They do some of the education there. We do some work around medical weight loss for our employees. And we survey our employees on a regular basis. And so we take that survey, we take those survey results. Sam mentioned the box. What was that called?
The suggestion
box. Yeah. So we take those surveys and change them into suggestions. And so we say, okay, this is what we're hearing a lot about. Let's see if we can do this. So that brought on the chiropractic care and other different things that we've added as part of our benefits to say, let's bring this in. An example, you had mentioned it about post-pandemic and some mental health services. That was a huge ask. There was quite a number of people asking of, could we get more mental health services? So we took our employee assistance program and upped the number of visits from 4 to 6. And then we added 4 coaching sessions for them so that those coaching sessions could really help them in really any parenting coaching or, time organization coaching or family work balance, that type of thing. So we use those suggestions.
And do I understand that correctly? You have an HSA plan, right? A high deductible.
Yep.
And you're still doing all these things within that HSA chassis.
Yes.
Yes.
We are.
Amazing.
So we do contribute to their health savings account.
Yeah. Jennifer, any thoughts on that?
Yes. I would just echo, a lot of what we've said here.
John, back to you. So I know that WPS has implemented medical leadership programs, and I think you have some friends, guests here in the room as well, right?
I do have some friends.
I was going to say, you don't have any friends.
No.
Is that what?
I hope I do.
Yes, you do. But I think you have some guests too that you're going to talk about, right? Can you explain the medical leadership program?
Yeah, and I don't think they're here today, unless they're here.
Maybe virtually. Yeah.
So those that work with me have worked with me for the last 10 years or knew me before. I'm pretty skeptical of corporate wellness programs, the programs that emerged in the 90s, and still are around to in some shape or another. One thing that so I was looking, what are alternatives to that, and there's a couple things that emerged in the last probably more in the last 10 years is people that understand kind of healthcare and when it's useful and when it's not, and a concept of pricing and a concept of maybe how overuse can be harmful. All of those things, kind of myths and facts about healthcare can be better. That can actually lead to lower healthcare costs and better care and better outcomes. People that understand their benefits are going to help with high value care and the better results on it. People that have a procedure or a diagnosis that follow a care plan. I don't like to use the word, but the words are like, are they adherents? Do they adhere to the care plan? Those are really important. And we found a couple of different partners, one called Meta Incentive, where we did a control trial where that program specifically, after certain procedures, essentially just provides information to patients, and they are patients in that case, post-care. And if they read the information and certify that they've read it, they get a small incentive. So you get high adoption, right? And it doesn't take much, a few dollars. We did a control trial. The results were so incredible to us that we didn't actually believe them, meaning like there wasn't the return that was shown, at least in the study that we did. But they were also so big that even if you change the assumptions dramatically, we did see things like emergency department admission reductions, readmission reductions, really meaningful things. And so we continue that program we did after the trial with our employees. I think that's a great one. Another one is really simple, and it's actually kind of fun. It's a program called Quizify from our old friend Al Lewis, who's the biggest wellness skeptic out there. And it's essentially a monthly quiz for our employees that does kind of those facts and fallacies about healthcare, but it covers nutrition, it covers our own internal employee benefits. So it's a good way to get people to learn about the benefits that are actually available to them. What I like about all of these programs is, at least in our experience, they worked. They're not coercive. They do no harm, right? Like that's been an issue for them. We don't have to worry about doing things to our employees, right? Why are you doing this to me or forcing me to do it? It's for them, right? And they can take it or not. And they're low risk, right? Because of that, and they're pretty reasonable costs. So those are the medical literacy programs that we're really happy with.
And what else do you do to educate, engage, remove barriers to access?
I think a lot of different things. I mean, part of it, just not to keep hammering on the Premier Network, but you can essentially make things free, right? You don't have to go through that deductible if they go through a certain path. Both as an employer, so as an employer, we've sort of refocused our corporate giving to mental health, and as an employee, and so we talked first about, okay, are there the right number of mental health providers? Are there enough mental health providers available to our employees, both live and in person, but also virtual options? So we've made a concentrated effort, and I think we just had a press release a couple days ago. WPS added close to 2,000 providers to our mental health care network just in the last 18 months. So I'd say talk about access and talk about a challenge there, right? We have that in our family where we've had challenges where you needed to move, find a new provider for a mental health care related issue, and you hear, and it's April, and you hear, yep, we can see you in September. And those type of access issues affect so many more people with the increased demand, particularly the pediatric and adolescent and teen demand for mental health care services. So we haven't solved that problem. That's not a problem you solve through benefit design or adding more providers to your network. That's a long-term issue that we need to solve as a collective,
as a community.
Yeah.
Yes, thank you. Jennifer, back to you. How do you choose the right partners to ensure that they share these very important organizational values that Sam was talking about, the culture?
Yeah. At least in our organization, we our HR strategy is great people, winning culture, and as part of that, we really build in and leverage our core values and talk about them in terms of why they matter, the behaviors associated with each of those values, how we want to operate as an organization, and then we use that to make decisions. We use it to make decisions on who we hire. We use it, in some cases, to make decisions on who we fire. But we also use it to make decisions on who we're going to partner with. And, when whether it's, on the healthcare side or, the vendors that we're working with, through, overall well-being and wellness, it's tying it back to, those core values and building that into the discussions as you're assessing the vendors, as you're assessing the partners, as you're assessing, what they're going to be able to bring to you as an organization. And, I think that ends up, being a win-win a lot of times, especially when you're trying to tackle and approach, big topics and big initiatives and really drive change and improvement in your organization. We actually, when I was at Trek, we had partnered with a vendor, and we had a situation where, as many organizations do, we had experienced a few years of some pretty significant cost increases in our plan. I mean, similar to what Michelle was saying. And so we challenged our broker at the time and just said, listen, we're going to have to think differently about how we approach our programs. And at the time we said we need to take $1 million out of the plan. And that was, that was more than just, let's see if we can get 5% out. And, and we said, we're not going to cost shift to the employees. This isn't just a increase the deductible or, shift the cost sharing. And, if you're partnered with the right organization and they're aligned with you on your vision, sitting in the rooms and really brainstorming the strategies on how you're going to, we don't want to reduce the quality of care. We don't want to reduce, the overall health impact to employees, but we need to address these elements. And so that, that wouldn't have happened if that vendor wasn't, aligned with who we were, our culture, what we valued, what we were going to prioritize in terms of our employees. And as a result, we were able to, really think outside of the box, get creative with partnerships, get creative with, how we approach the plans, and saw some pretty significant results as part of that.
That is awesome. Michelle, your thoughts on that too?
Thank you. Our HR strategy is we're here to make great things happen for our people. And we really, and I had the opportunity to hire a broker as well as our TPA. And part of that discussion is how can we work together to be able to pull the data that we need to say, where are our top 3 spending areas? So we were able to, and they have been wonderful to work with, but we were able to pull, these are our top 3 areas of spending. And one of them was preventive care, one was orthopedic care, and the other one I'm just told, RX spending. And so we all kind of put our heads together and brought in our DPC and said, how can we drop our spending in these areas? And so we were able to take that, and after we had increased the deductible and said, okay, we haven't raised our premium or deductible in 8 years since we did that. And so we continue to drill down on the data that we have and say, where can we save more money? And so that just really helps us in our TPA and our broker. And, even our DPC are very helpful with all of that.
Who would have thought data is important, right?
We actually have a couple of questions from the audience related to how do we figure out the right balance of the employer share and the employee share when it comes to rising costs, but also if you have any ideas to help reduce the costs overall for healthcare for the workforces and families.
Who would like to?
Yeah, I mean, I'll just chime in with I think, as we were discussing just now, is I really do think data is the biggest, the biggest piece. I mean, wherever you can partner with and leverage the vendors that you have to really dig into the data. It's one thing to get a dashboard to see that, preventative care is this and maybe high level what your prescription costs are. But then having regular conversations with partners, there's a lot of you here who all have experiences with things that work and things that may not work. And, I just found that using the data to help make decisions, dig in, ask lots of questions, and then making sure that you're, networking and talking with other organizations, even just sitting here with John just, has triggered a number of things where, I've got to follow up with those 5 things. But so I think once you've, dug in and really understand the data, then you can see where some of those big shifts might come in being able to attack some of the costs and drive some of that cost out of the overall plan.
Because what I'm hearing from all 3 of you is that keep shifting the costs to the employees is just not an alternative anymore. We've done a lot of that as employers over the past decades. We just can't keep doing that, right?
Right.
Yeah. John, thoughts on that?
Yeah, no, I agree with what you said. Specifically, I think navigation to high value care is the biggest opportunity we have right now, and it's the lowest hanging fruit. I mean, we've got some folks in here that can offer MRIs for $750 or less, or we can pay $4,000.
Yeah.
Which one do you want to spend it on? Right? There's new orthopedic opportunities out there where you can get a knee replacement for half the price that you have to pay at one of the systems. And it's the same docs that used to work at those systems. So I'll just use a couple of examples. There's a lot of opportunities. Price and quality are not related. So let's dismiss that notion. Yes, we need to have some understanding of quality, but I think navigation to high value care is the best. I guess not a silver bullet for everything, but it's the best starting point that we have right now.
Melina, can I ask a follow-up question?
Yes, of course.
On that point. So when I talk to employers about encouraging employees to use providers that do a good job and cost less, I get two points of pushback. One is, once employees meet their deductible, they don't care. And then a second thing is people conflate high price with high quality. How have you, and I've heard threads of addressing those issues from each of you. I wonder if you could just, though, any of you or all of you address that more directly. How do you overcome those 2 concerns?
I'll
Go
maybe
for it,
start.
yes.
For generally, most employees don't understand health insurance and self-funding. They don't know a lot of these terms. And part of our insurance roadshow, we use the analogy of a bucket and say, you put money in this bucket for your premiums. We put money for premiums on your behalf. And how we spend this money is really important, because at the end of the day, if there's no money left in that bucket, the money that we go to is Fund 10. And they all know that Fund 10 is how we pay their salaries. And so that together we can all work to make sure that there's money in this bucket at the end of the day, so that we can pay the bills and we can pay all the claims that are out there. So we really do a lot of work about helping employees understand self-funding. And so that kind of gets back to, I already spent my deductible. It doesn't matter. The other piece is we will share the difference. So we started really, we try to work on the just little things. Like, for example, we can say, if you go to this organization, which is in a neighboring community, it's going to cost $12,000 to get a colonoscopy. But if I can pay for you to stay in a hotel overnight and have a travel partner and pay for your mileage and pay for a meal plan the next day, you can go to, it's Minji for us. You can go to Minji, and it's going to cost us a fraction of the cost. Plus, we're going to give you $500 that we can either put in your paycheck or put in your HSA. So I think that anytime you can provide that incentive or the carrot for people to say, okay, I'm going to be part of the solution. And it's amazing, over the 8 years we've been doing this insurance roadshow, employees are like, Jennifer, you know that you don't pay any money for that, but the district pays money, and that comes out of that bucket of money. So there's a little bit of peer pressure, I feel like, yes, but we want to be able to get an increase in the end.
Yeah, and actually I was going to ask something similar, because Michelle, you live and work and play in a smaller community, right? So maybe you don't have, I mean, we're seeing some of the great providers that we have here. Not all of them are. So Wisconsin has pockets of underdevelopment in healthcare. So I wanted to ask as well, how do you incentivize, okay, you'll travel to Minnesota versus going to the neighboring city? That's a difficult proposition. So what I'm hearing is you do it in the roadshows and sort of one-on-one conversations, constant visceral relationships, right?
Yes, absolutely.
Yeah.
So we work one-on-one. Employees will come to HR. Our on-site clinic is not far, and they kind of feel like we're an extension of the clinic. Even with we don't need to know your health care, but if you have a question, we can help direct you into the right place. But we can use that example of the colonoscopies. In the time that we've been promoting our employees to go to Minji, we have saved we're calculated that our savings was $440,000, which is getting close to $500,000. That means a lot in education. We can buy a lot of things for $500,000. So I think that is, just that knowledge that people have, it really helps. It makes a huge difference.
I would say too, just to kind of add on to that, I think a thread through all of this is also the convenience of care. It's surprising that it's actually less expensive for us to bring care to our employees, which, by the way, is more convenient for them. It's easier for them to access it, but ultimately, impacts the overall cost of the program. So. Don't underestimate that, you might have to spend a little to bring those services to you or to your employees on site. And that, I think, in and of itself, I've had very little pushback from employees saying, you've brought in this service or this support, or, and a question around the quality of that care. Typically, if the organization is sponsoring,
right, it should be high quality, right?
Yeah. So it kind of takes that out of the equation in terms of the conversation.
John, a different question, but along the same lines.
I want to answer that last one.
Please,
I want to hire Michelle.
You want to hire Michelle
to do that communication plan and that motivation. So sorry.
Yes, and your CEO is not here, right? So we're just making decisions without her. Yes. You have a job, Michelle. Positive results that you have experienced by choosing the right benefit partners to support your employees. And I thought you were going to introduce the Leo program before.
Well, I will.
That's why I was pointing, but yes.
Results I'd just say positive, like they come from ideas, right? Like we need creativity, and this will feed into it a little bit, both internally from our team, but people that we work closely with, like the Alliance and Oxient, like there are, somebody has to spark that idea to do something a little differently. So I'll go to Leo. We do a lot of measurement of engagement and motivation and productivity, and I'll say pre-COVID those numbers were going up, and we were doing a lot of things, and I can't tie it to one specific program. And during COVID those numbers actually stayed pretty constant,
which is amazing,
which was a huge win for us, and it's hard to tell, like, there was no bright line that said it's over. So, but generally speaking, pretty amazed by that, and also some of the output metrics, retention of our high performers and our core performers has been really good. So many different variables. So it's not all going to be tied to a benefits plan or
Right.
other fringe benefits. We a couple years ago, and a couple years ago, it feels like a couple years ago now. It's 6 years ago, I think. We is actually one of my colleagues who's now our chief people officer was at a presentation of maybe something like this in Madison, but it wasn't. I think it was put on by UW. But the guy was up there talking about his program, the Leo program, and it's Dr. Raj who's sitting right over there, and it was this really interesting presentation on really based on research and a passion that he had for doing research on brain science and how you can apply that the emerging brain science and also some brain science that's been around for 20, 30 years, but how can you translate that into both work and life, increasing fulfillment, increasing creativity, increasing productivity, and how can you reduce stress and all those things? And it sounds magical, right? It's what we all want. It's what people go to cognitive behavioral therapy for and pay a lot of money over time and get some results. Moira heard this and came back and said, I just saw this really intriguing thing. And then we had him come speak to all of our employees at a management meeting, and we had a 3-hour session. And it was nobody, I would say nobody. I remember seeing one person like on their iPad flipping through the Wall Street Journal. And later when I talked to Dr. Raj, she said, well, 10% of the people are just going to reject it and not get it. But so many other people were just buzzing in the room, like, I want more of that. So we worked with him to develop a program, and he was down this path anyway, a program for our employees to put them through this. So how do you, and I won't get it right, but we use concepts now across our company that are tied to that program that hundreds of our employees went through and all of our leaders did. I think I've been through 3 different versions of it. We'll probably go through another one, but it's actually kind of simple. It's if you can stay in this concept of your higher brain, that's where your creativity comes from. And it's really how do you stay out of your lower brain, which is the part of our brain that is like that automatic response, that survival, that drives stress. It actually is really simple in concept, but you practice, and then you try to get everybody else to go along with it. So this is a program, and I remember 4 or 5 years in that we said, this is the best wellness program that I think a company could offer. So I don't know. So clear pitch for Dr. Raj, but I appreciate him and that program, I think about results and alignment with that purpose, right? Alignment with that purpose, especially of HR departments and people that are kind of, trying to make life better for your employees.
Mm-hmm. Jennifer, do we have any more questions? I know people are texting them, which I love, by the way, so thank you. Jen?
Yes, we do, but we really only have time for one more question. So I just want to ask if anyone in the room has any questions before I launch into more.
And I have more here, but I know I'm getting the signal of the 5 minutes, so.
All right, can you talk about a benefit that you think has had a huge impact on your employees that you've been able to implement?
I just did, so I'll let somebody else go.
I'm trying to think of an overall benefit. I mean, I think there's a lot of
on-site clinics, right?
Well, I think the on-site clinics, and just really on-site services. I think that just the convenience of care, I think is a huge thing. I don't know if you've got so many little pieces, different
I think there's so many different elements to that. And I think we offered, and again, this is just drilling down on our data. We said, let's offer 3D mammography and pay for it. Our plan doesn't cover it, but let's cover that. And so we contracted services with a local hospital that had the 3D mammography, and we had a spike in breast cancer, and which we were like, this is a good thing, I guess, but obviously also a bad thing. But we also had more people that were catching early, stage 1, stage 2, and they were very they will still come back and say thank you because that caught saved something. My life. Yep, it saved my life. Right. We also started this program for we have an older population that drives our students that drive off site or that are brought off site. We said, I think I remember watching something on the news about a bus driver having a heart attack, and the bus going off the road. And I said, we really should do like just a heart screening on our drivers. And we had 2 of our 6 drivers that had like 90% blockage. And, they have both come in and said, you saved my life. Had I not caught this. So I think they're just the little things. And that's that relational piece of really connecting with your employees to say, hey, we should do this. And it's based on feedback from your employees.
I think, if I were to kind of sum up how I would kind of articulate that is, it's kind of contradictory. It's spend money on things that will help prevent the bigger things, right? So it's not, when I think about, is there one benefit that we provided? I don't know that there's one benefit, but where we chose to spend money on, educating people about their nutrition or their number, or diabetes. I mean, spend money on those programs. It might seem, you kind of add up these, it's the impact on the long term that's going to have not only on the health of the employees, but also, on the overall cost for the program. So again, it's kind of seems contradictory.
Right.
Spend a little bit more on that front end for programs that, are going to detect and save the kind of longer term health and well-being.
Can I ask for a last thought from each one of you? Can I start with you, Michelle?
I would say I had very little knowledge on health insurance and benefits when I became an HR director, oddly enough. And my broker was, I worked with him very closely to say, okay, what can we do to save money? We need to save money. And so it's start small, even though our first big thing was the clinic. And just keep building on your programming. And I think in the end, you can save millions of dollars in helping your employees be more healthy.
Yeah, I think for me, it's events like this are a reminder of how important it is to get out and network and have conversations and talk to people and benchmark and ask questions about what's working for you and what should we try. So wherever you can kind of get information, just a reminder, I think, to continue to do that, because especially in the healthcare marketplace, and it has a significant impact to our employees and costs, but it's also really complicated and complex, probably more than it needs to be. But the more people you talk to and educate yourself, I think that can just have such a big impact.
And John, last word from you.
I like both of those. Don't get stuck. Try new things, because that's we don't have all the right solutions yet, right? We all know that. So keep experimenting.
Celebrate failures too, right?
Yeah.
Help me to say thank you to them.